A second nurse diagnosed with Ebola arrives in Atlanta for specialized treatment. But tonight, new questions about the people who had contact with her within the last few hours. Good evening, everyone. I'm Maurice Dubois. Christine is off tonight. That nurse is now in an isolation unit at Emory University Hospital. Today, we learned shortly before her diagnosis, she took a commercial flight and passengers are being contacted. And President Obama now calling for a rapid response from the CDC, as well as late tonight, canceling a trip planned for tomorrow. CBS 2's Dick Brennan has more now on the Ebola outbreak.
The second nurse diagnosed with Ebola is 29-year-old Amber Vinson. She's shown here in the yellow suit, getting out of an ambulance at Emory University Hospital in Atlanta for treatment. She took a commercial flight a day before her diagnosis that has people worried. She flew Frontier Airlines Flight 1143 from Cleveland to Dallas, and she boarded knowing she had a low-grade fever of 99.5.
The healthcare worker number 2 should not have been allowed to travel by plane or any public transport by virtue of the fact that she was in an exposed group.
The group that treated Thomas Eric Duncan, who died last week of Ebola. Officials are now trying to track down 132 other passengers, although Frieden says their risk of infection is extremely low. Now there are serious questions about whether healthcare workers were properly protected. President Obama met with his cabinet.
We're going to make sure that something like this is not repeated.
Vincent was diagnosed just 2 days after her co-worker, 26-year-old Nina Pham. The nurses union says the Dallas hospital was not prepared.
We're a hospital that may have done some things different with the benefit of what we know today.
Despite the 2 cases, there are no plans to quarantine the 75 other healthcare workers who were possibly exposed while treating Duncan.
If they have any temperature or any other, loose stool or any other symptom, they immediately go to isolation.
And after everything that's happened, look at this video of Nurse Amber Vinson boarding a plane in Dallas. Notice the man on the tarmac nearby wearing no protective gear.
The fact that the worker that we see is not in a biohazard suit sends a bad message. It sends a message that either they're not taking this very seriously or maybe they don't really know what they're doing.
But Dr. Max also says because the nurse is in a protective suit, it's highly unlikely she would spread the virus. In the meantime, the CDC says Vincent was actually cleared to fly on Frontier Airlines by an agency official, even with the fever, because it was less than 100.4 degrees and she had no other symptoms. Maurice.
Okay, Dick, thank you. In our area, the Port Authority is preparing for possible cases here by giving officers high-risk kits. And starting tomorrow, special screenings will begin at Newark Airport for passengers arriving from West African countries. They are already in place at JFK.